Metagenics Institute is proud to bring you MAPS, a grassroots program of practitioners sharing their clinical pearls through a series of 20-minute talks on personalized lifestyle medicine, health conditions, and practice management.
And you see, in America, we have over 15 million hypertensives. We have over 12 million diabetics, and we have over 8 million cardiovascular disease patients, most of which are preventable. And yet we're struggling to take care. And this burden was only going to get greater as they projected by 2020. And so they wrote this review, this article, in hopes of changing the mindset, of getting a different idea about how we could approach chronic illness. Well, this resonated with me, and so I looked at the article, and it was interesting because they came up with four obstacles that were kind of holding us back. And one was demands on physician time.
Now, one of the things that nutrigenomics is teaching us, which is the science of how nutrients impact our gene expression, what we're now learning is that 1 calorie is not always perceived in the body in the same way from the same food. So 80 calories of an apple is going to have a different effect in our bodies than 80 calories from a brownie. Yet, there's still 80 calories, but you can imagine that their contributions in terms of what they're providing us is a little bit different. So yes, food is energy, but I want you to think a little bit broader than that, that with the newer science that we know about food and nutrigenomics, we're learning that there's a lot more there. It's not just about calories.
Now, have you ever asked yourself, when you see these patients in clinic, what is it about almost every single disease we see? There always seems to be a connection somehow to the gut. Is it a chronic fatigue patient? Is it the fibromyalgia patient, the migrainer, the asthmatic? It's always shocking to me that somehow, before that clinic appointment is done, I have slipped into becoming the GI doctor of the day. So there's real evidence.
If you feel the same way that I do about some of these issues, it's time for a change. We, as physician leaders, have to stop making excuses for the system, for ourselves. We can no longer blame the system. It's time for personal responsibility. Medicine is not making us sick, and it's not making our patients sick. We are. In our acceptance and reluctance to change how we practice.